In this video, I'm going to give 7 tips for people involved in the Social Security disability process based on comments and questions I've gotten in my YouTube channel and based on some patients that I've actually examined for Social Security disability. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, the first issue, a person asked, do I get Medicare as soon as I'm approved for disability? And the short answer is no, there is a delay. If you qualify for Social Security disability income, you automatically get enrolled in Medicare. But it doesn't happen immediately. It happens 24 months after your Social Security disability payments begin. And normally Social Security disability payments begin 5 months after the date Social Security determines that you became disabled. So there is a potential 29-month waiting period between when you become disabled and when you get Medicare. Social Security will send you a Medicare card in the mail, usually about 3 months before you qualify, and the card will have a start date on it, which tells you when your Medicare health coverage begins. And Medicare is pretty good health coverage. Now, if I had a bone to pick with Social Security disability, this would be number 1. Time and time again, I see people who've had a terrible illness or injury, become disabled, can no longer work, so their job stops, their income stops, they're now sick or injured, and they need medical care, but because their job has ended, their health insurance has ended as well. So they wind up sick or injured and unable to get the medical care that they need. I've seen quite a few people who were prescribed medication and couldn't afford to either see a doctor to get a prescription for the medication or pay for the medication. And I'm not talking about a trivial issue here. I'm talking about medication that would keep them alive. I don't understand why the government thinks it's reasonable to make somebody wait 29 months for medical care when they're disabled. I think it should begin immediately. Nevertheless, that's what people applying for Social Security disability are facing today. Now, there is a potential that the waiting period may be shorter if Social Security determines that you became disabled months or a year or more previously. Remember, it begins on the 24th day after your disability payments begin. So if you have back payments, you may get Medicare before 24 months. If that's your situation, I would recommend that you speak to someone at Social Security or speak to a Social Security disability attorney to determine exactly when you will get Medicare coverage. The next point I need to make is about rare conditions. I had a person ask if I would make a video about a condition which is abbreviated VACTERL, V-A-C-T-E-R-L. And this is a very serious condition that children are born with. It's what we call a congenital abnormality. And these unfortunate children are born with all sorts of problems. The issue is, this is a rare condition, and I have never seen a person with it in my entire medical career. and I don't want to give out-of-date or erroneous information. So if I've never seen a person with a condition, or if it's extremely rare, I don't think it's a good idea for me to make a video. If it's a fairly common situation that I've seen many times, then yes, I will make a video. So please keep the suggestions coming. The third comment I see over and over again is, I paid into the Social Security disability system. It's not fair that I get my money back. And people who make this comment don't understand the Social Security disability system. It's not a savings plan. You don't pay in your money now and get the money back at a future date. Social Security retirement income is a savings plan. You pay into the system while you're working, and when you retire, as long as you're age 62 or over, you get money back. It may be less than what you get paid in, it may be more than what you paid in, depending on when you decide to start your payments and how long you live, but it is a savings plan. Social Security disability income, known as SSDI, is an insurance plan. It's to insure you against becoming disabled during your working years. Think about it like homeowners insurance. I've paid homeowners insurance premiums for decades, and I've never gotten a penny back. And I hope I never get my money back, because that would mean something terrible had happened, like my house had burned down. There is no guarantee you will get your money back when you pay insurance premiums. But if something terrible does happen, like my house burns down, I'll get money. And if you pay into Social Security for disability insurance and you become disabled, you will get payments. The next point is, somebody commented that any illness medical doctors don't know everything about is automatically labeled a psychiatric disorder. And that's simply nonsense. Let me give two examples. Doctors have no clue, no idea whatsoever what causes the common headache, which we call a tension headache. Likewise, doctors have no clue, no idea whatsoever what causes common low back pain, what we call a low back sprain or strain. And yet we don't consider either of those problems a psychiatric condition. There are three criteria for determining that a physical problem is actually a psychiatric problem. The first is lack of pathology. Pathology means abnormal findings that another person can see. An example would be a woman who develops breast cancer. The doctor may feel an abnormal lump in the breast. That's called clinical pathology. The person may then undergo surgery, and during the operation, the surgeon may find a lump of tissue that looks cancerous and remove it and send it to the lab. That's called surgical pathology. In the laboratory, a doctor who's an expert in pathology will first examine the lump and describe it, which is called gross pathology, and then have slices made of it and look at the slices under the microscope. And breast cancer cells look very different from normal breast cells, and that's called microscopic pathology. Other examples of pathology include tests of the blood or urine, or imaging studies such as X-rays, MRI scans, or CT scans. The first criteria for a psychiatric problem is that there is no evidence of any pathology. But that's not enough. The person also must have evidence of a psychiatric illness. On evaluation, they must appear to be mentally ill. And then the third criteria is that their physical complaints must be what we call non-anatomic and non-physiologic. They must not fit with the way we know the human body works. An example is a person I saw who told me that they had low back pain and that the back pain spread up their spine into the eyeballs. That is impossible because there is no connection in the nervous system, musculoskeletal system, or brain that connects the low back and the eyeballs. It's like as if the patient had said, if I flap my arms, I can fly up into the sky and land on the moon. It's simply impossible. If a condition meets all three of those criteria, then we say it's a psychological condition. The next question and point that I get from time to time is people will ask, can I do their CE exam? Can I do their Social Security exam? And I'm afraid the answer is no. When Social Security schedules somebody for a CE exam, they choose the time and the doctor who will do the exam. It's not like the doctor has a choice of which patients they want to see. Remember, the CE exam is not ideal. The ideal evidence for Social Security disability is a functional report from a doctor who's known you over time, either your primary care doctor or a specialist that you have been seeing more than once. If you can get a doctor who knows you well to fill out a functional report to send to Social Security, that is the best evidence you can present them. As an attorney who made a good video that I watched on Social Security said, he said to all of his clients, go to the doctor, go to the doctor, go to the doctor. You need ongoing, continued evidence of your medical problem, if possible. The next issue is related to the very first one, rare conditions. If I'm scheduled to do a CE exam on somebody with a rare condition or a condition I've never seen before, how do I prepare? And this happens from time to time, and it's one of the things that makes doing CE exams interesting for me. I'm in my 48th year of examining patients, and I still get people with conditions I've never seen before in my life for Social Security CE exams. Before the day that I do CE exams, I'm given some records on each person. And if I see that somebody has a condition I'm not familiar with, I do some research before the day of the exam. I look up the condition, I make notes on it, and specifically, I make notes on what I should be looking for in their exam. An example would be I recently did a CE exam on a person with Fragile X syndrome. This is a genetic problem. And I made a list of all the things I should be looking for. And for an example, one problem these people have is their joints are hyperextensible. They're what we call in layman's terms double jointed. And when I examined the person, sure enough, they had remarkable double jointedness, which fit with their diagnosis of Fragile X syndrome. The next tip has to do with income and Social Security disability. A person wrote and said that a friend who was receiving SSDI, Social Security Disability Income, had made a big profit on a stock investment. Would that affect their disability payments? And the answer is no. Things like savings, income from stocks and bonds or savings accounts, income from rental properties, any sort of income that does not involve work does not count against Social Security disability income payments. The only thing that counts is if you make money by working. That can be working for someone else for wages, or if you're self-employed, it can mean earning money at your self-employed job. And in 2025, this means that if you earn over $1,620 a month, your Social Security disability income payments will likely be terminated. There's a lot of confusion between Social Security disability income, what's abbreviated SSDI, and supplemental security income, what's abbreviated SSI. Now, these two programs are similar in that, number one, they're both administered by the Social Security Administration. And number two, they both require disability, inability to work due to medical problems to qualify. And the qualifications are the same for both programs. But everything else is very different. SSDI, like I said earlier, is an insurance program. You will get your monthly payments whether you have no money at all or whether you have $1 million in the bank. Just like if you pay homeowners insurance and your house burned down, you would get a payout from the insurance company whether you had no money or you had $1 million in the bank. SSI is different. It's a welfare program. And SSI, because it's a welfare program, will not pay if you have savings or other assets over a certain amount. Finally, and this is a problem I see over and over again, and I've talked about before, but I'm going to repeat it. When you fill out Form SSA 3373 and there is a question, please describe how you spend an average day. Please don't say that you do nothing all day. I recently read the result of an interview between a Social Security employee and a person applying for disability, and the Social Security employee had written, "Claimant reports his daily routine consists of doing nothing." Now, first of all, if you don't do anything all day, you're wasting your life and you should get a move on. And second of all, I think people think that if they say, "I don't do anything all day," the Social Security Administration will feel sorry for them, that they're so terribly disabled they can't do anything, and approve their disability application. And in fact, that's wrong. It was clear from what the Social Security Administration employee had written that they thought this person was lazy and were not inclined to approve their disability application. Don't make your laziness a feature of your disability application. Social Security wants to see evidence that a person is trying to improve their situation in order to return to work, if possible. Even if you're completely crippled from arthritis and can barely do anything physical, you could still, for example, listen to audiobooks on your phone and try to improve your knowledge. Everyone has a phone these days, including homeless people. And believe me, I've examined and treated many, many homeless people throughout my career, and they have cell phones. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.